Today, we're diving into something truly game-changing in public health. It's happening in India, and it's a massive effort to protect an entire generation of young women from a deadly but totally preventable disease.
I want to start with just one number, 80,000. Let that sink in for a second. That's how many new cases of cervical cancer are diagnosed in India every single year. It's a staggering figure, and it's really the starting point for this whole story.
So when you see a number like that, the next question you have to ask is, what if it didn't have to be this way? Just how many of these cases, how many of these lives could we actually save? Because the answer, as you're about to see, is almost all of them.
Now, to really appreciate the solution, you first have to understand the sheer scale of the problem. So let's start right there.
This chart really lays it all out. You see the 80,000 new cases we just talked about? But look at the other bar. Over 42,000 women die from cervical cancer in India every year. It's the second biggest cancer killer for women in the country. But here is the absolute key, the twist in the story. Despite these awful numbers, it is largely preventable. Okay, so if it's preventable, what exactly are we fighting against? That brings us to our next part. We need to unmask the culprit.
And you know what? The cause is incredibly well known. The science is settled. Pretty much every single case of cervical cancer is caused by a long-term infection from a really common virus. It's called the Human Papillomavirus, or HPV. The link is undeniable.
And we can get even more specific. Check this out. In India, just two specific types of this virus, HPV 16 and 18, are the culprits behind more than 80% of all cervical cancer cases. So this isn't some wide, scattered battle. We have a very clear target.
You know, they say knowing your enemy is half the battle. Well, we know the enemy. So what's the other half? The solution. And that brings us to what's being called India's National Shield.
And here is the plan in a nutshell. The Union Health Ministry is rolling out a massive countrywide HPV vaccination program. And look at their focus, it's laser sharp. They're targeting girls at the age of 14. Now, why that specific age? Well, it's the perfect window to give them protection long before they might ever be exposed to the virus. It's all about getting ahead of the problem.
And how they're doing this is just as important. First off, it's completely voluntary. No one's being forced. Second, it's totally free of cost. And third, the entire goal is to make sure every girl has access, no matter her background. This is public health for everyone.
So that's the big idea. But how does a plan this ambitious actually work on the ground? Let's get into the nitty-gritty of the vaccination plan.
Okay, here's the breakdown. The vaccine being used is Gardasil. It's what's called a quadrivalent vaccine, which is just a fancy way of saying it protects against 4 types of HPV, including those 2 big ones, 16 and 18. And the dosage? Just a single, effective dose. That's it. And to make sure everything is done right, the shots will only be given at government health facilities by trained professionals.
And you know, a project this huge doesn't happen in a vacuum. India is partnering with Gavi, the Vaccine Alliance, to get the vaccines. This is a huge deal because it guarantees a high-quality, steady supply, which is exactly what allows the government to offer it for free across the entire country.
So a plan this big, this bold, has to be built on solid ground, right? It has to be based on science. So let's talk about the evidence. Let's talk about the proof.
Now, you might have noticed I said a single dose. And that's not a shortcut. As a top health ministry official put it, the scientific evidence, both from around the world and from right here in India, confirms that one single dose gives strong, long-lasting protection.
And let's be super clear on safety because this is so important. The HPV vaccine is a non-live vaccine. What does that mean? It means it's not a live virus. It absolutely cannot, it is impossible for it to cause the HPV infection it's designed to prevent. It's a piece of smart technology built for one job, protection.
And this isn't some brand new experimental thing. Just look at this number. Over 500 million doses of this vaccine have been given safely across the globe since 2006. It is one of the longest and most studied safety records out there.
And what about effectiveness? Well, the results are just incredible. The evidence shows that it's between 93 and 100% effective at preventing cervical cancer caused by the HPV types it covers. I mean, those numbers speak for themselves. The protection is powerful.
And finally, this single-dose strategy that India is using, it's not an outlier. It's actually becoming the global best practice. More than 90 other countries are now using single-dose schedules, which makes this powerful prevention tool way more accessible for millions of people.
So, you put all of this together, The problem? The science? The plan? What does it all add up to? Let's zoom out and look at the big picture. A healthier future.
When you boil it all down, the real story here is about being proactive. This program isn't about treating cancer after it's already there. It's about going right to the source and preventing the HPV infection from ever taking hold. It stops the disease before it can even start.
And this leaves us with a really powerful, really hopeful question to think about. With a tool this effective, rolled out on a national scale with this much care and planning, could this actually be the generation that sees the end of cervical cancer as a major public health threat in India? For the first time, that future feels truly within our grasp.